Go. I got this down.
Okay.
Once the device is plugged in, it has just the main power switch right here. You flip it on. It's as easy as that. You don't have to worry about any of the settings. It's all preset for you. So we just turn it on and we will position the pads on his feet and we wait for this to flash blue. Once this flashes blue, we're gonna press it and that starts the therapy, and it will start it at 30 minutes and it does a countdown, so you don't need to worry about like shutting off or anything. It shuts off when it's done. So here are the two pads, and we're gonna start by placing these. The device does come with an ACE bandage. I have done sweatbands because it's just a lot easier than to wrap a ACE bandage to keep it in place, especially with neuropathy patients who have numbness. They will often not feel when their foot's not touching the pad. You always want to put the black side on the part of your body that you're treating. All right.
Okay.
So that's the side.
So
you
the black
use.
side up.
Black side up. Yes. And so it is most effective whenever you remove shoes. You can leave socks on. So I'm going to take your shoes off. Let's see. Yeah. All right. I guess I should have had you remove these before, but it's all good. Okay. All right.
Now, what were you saying about a pacemaker? Patients that have pacemakers?
What I was going to start with, this device in a nutshell. It uses the same technology as an MRI or CT scan, meaning that it does use electromagnetic waves. And through these waves, it's using shortwave diathermy. The shortwave diathermy is what's doing the work on the neuropathy. It's going to penetrate 4 to 6 inches to the nerve. And when it's doing this, it's increasing the circulation to that deep soft tissue. And when circulation's increased in that area, the inflammation will decrease. And then when inflammation decreases, so does pain. But because this is electromagnetic waves, just like when you can't do an MRI or CT scan because of the pacemaker. This is not as powerful of electromagnetic waves as that as an MRI or a CT scan, but you do want to be cautious in keeping it away from the upper body area, because I know a lot of times patients with neuropathy experience pain like sometimes in their arms or their hands. So for you, just to be safe, we're going to keep it away from that area.
So it's for the lower extremities only for him.
So we're going to use lower extremities for him.
Okay.
Yes. All right.
Does it matter which foot is on?
Nope.
Okay.
Nope. And so a lot of times people will say, "Oh, is this like a TENS unit?" I think that's just the number one thing people want to compare it to, because that's what is prescribed and popular. This is very different from a TENS unit in the fact that it's going to work. It does a lot deeper tissue work, okay?
Oh, okay.
And a TENS unit, you would have to have the two pads operating together because of the circuit, whereas each pad works independently of each other.
Oh, okay.
So if you don't have one pad on, it's not going to affect the treatment. They work independently of each other, okay?
Okay, great.
So